Bismillahirrahmanirrahim. Today I am discussing lesion in the visual pathway. I have already discussed the visual pathway in lecture 1 in detail. For quick recall of the memory, I am briefly discussing it here again. Visual pathways start from the optic disc, receiving fiber from nasal and temporal ganglionic cell of the retina. Here this start and receive fiber from the nasal and temporal ganglion cell of the retina. Emerging from the orbit as optic nerve through optic canal or nasal fiber of the optic nerve cross to the opposite side at the level of optic chiasma in middle cranial fossa where pituitary gland is located. The temporal fiber remain on the same side without cross to the opposite side. The nasal and temporal fiber constitute the optic tract and end in the lateral geniculate body, from where through optic radiation signals are transmitted to the visual cortex by two loops or optic radiation. Mirror loop, also called the lower or inferior optic radiation, pass through the temporal lobe of the brain. This is the lower lobe or mirror lobe, and it passes through the temporal lobe to the visual cortex and ended at the lower bank of the calcarean fissure, and the upper optic radiation ended at the upper bank of the calcarean fissure, passing through the parietal lobe. The mirror lobe passes through the temporal lobe, pass through the parietal lobe, and they end at the upper bank of the calcarean sulcus. Mirror lobe and in the optic radiation area in the optic cortex or in the visual cortex in the lower bank of the calcarean sulcus. This is the calcarean sulcus, this is the upper bank, and this is the lower bank of the calcarean sulcus. Now lesion in the optic nerve. First lesion is at the level of optic nerve. Result in complete loss of the vision in the right eye. If it is on the right side, it will cause complete loss in the right eye, or if it is on the left side, it will cause complete loss in the left eye. This may be seen if the patient has an optic nerve glioma anterior to the chiasm. Second lesion is at the level of optic chiasm. This is the optic chiasm. Here you can see the fiber from the left eye cross to the right side and fiber from the right eye cross to the left side, and the junction of these two crossing fiber is called the optic chiasm. So this area contains fiber from both the nasal side of the retina, and if damage occurs in this area, the lesion of the optic chiasma disrupt the axon from the nasal field of both eyes, resulting in the loss of vision of the right half of the right visual field and the left half of the left visual field. This visual defect is called non-homonymous bitemporal hemianopia. Remember one thing, that the temporal field of vision is received or perceived on the nasal side, and the nasal side of vision is perceived on the temporal side. At the level of optic chiasma, we have fiber from both nasal side. On the nasal side, we receive vision from the temporal side. So bitemporal vision loss occurs when there is lesion at the level of optic chiasm. This is non-homonymous bitemporal hemianopia. This is on the right side of the right eye, and here again it is on the left side of the left eye. Both the poles are different from each other. If you will look on a scene, the scene will look like this. The temporal vision is lost, and both the nasal side there is lesion in the optic chiasma. The scene at the nasal side will be visible. Pituitary adenoma. This is frequently caused by pituitary adenoma. This loss of vision bitemporal loss of vision is caused by the pituitary adenoma, accompanied by amenorrhea in women and reduced sperm count in the men. Pituitary tumor may also secrete prolactin and growth hormone. So in some cases, prolactin is secreted in large quantity. It causes lactation, and if growth hormone leads to gigantism. Core lesion is a lesion of the right optic tract. This lesion occurs in the right optic tract. A lesion of the right optic tract that carry axon from the ganglion cell of the temporal retina of the right eye and the nasal retina of the left eye both see objects in the left visual hemifield, result in blindness in the loss of vision occur in the left field of vision. Optic tract, we have fibers from the temporal side of the same eye and fiber from the nasal side of the opposite eye. The lesion or loss of vision occur in both eyes, but when in one eye it occurs on the right side and on the left side. This visual disorder is called contralateral left homonymous hemianopia. Homonymous deficit refers to the same half of the visual field of each eye. Left homonymous hemianopia. If the lesion is in the left optic tract, the vision will be like this. The temporal vision will be lost, and in the left eye the nasal vision will be lost. Right hemianopia. So here in right side, here you can see the middle or the nasal side of the vision is affected, and in the left eye the temporal side of vision is affected. Cross section of the anterior optic nerve. This is the eye and this is the anterior portion of the optic nerve. When cross section is taken, it gives us this picture. This shows the distribution of the nerve fiber. SN superior nasal, SN or the superior nasal fiber are from the superior medial side of the retina. Fiber originate from the superior side of the nasal retina. And ST is for the superior temporal retina. These fibers carry information from the superior aspect of the retina. M is for macular portion of the retina. And IT is inferior temporal. This is the inferior temporal part of the retina, and IN is inferior nasal. Occipital lobe. Superior optic radiation project to the superior bank of the calcarean fissure. This is the lateral geniculate body. From here the radiation occur in two pathways. One is the superior and the other is the inferior. The superior radiation pass through the parietal lobe and at the upper bank of the calcarean sulcus or calcarean fissure. And inferior optic radiation will project to the lower bank of the calcarean fissure. The mere loop or inferior optic radiation, and it ends in the lower bank of the calcarean fissure. This is calcarean fissure. This is its lower bank and it is its upper bank. Inferior optic radiation from the Meyer loop. Inferior optic radiation from the Meyer loop, which carry information from the inferior retina and thus the superior visual field. Radiation pass into the temporal lobe, and therefore temporal lobe lesion result in contralateral homonymous superior or quadranthopia or pia in the sky. So this person, when look upward, he will see dark area. He will look to the sky. He will see these dark spot or blind spot in superior optic radiation pass by the parietal lobe, and therefore lesion of the parietal lobe result in contralateral homonymous inferior quadranthopia pia of the lobe. when a vascular occlusion of the middle cerebral. This is the example here. If he will look up to this scene, he will observe dark spot when he is looking up to the sky, and if he in the lower left quadrant or when there is lesion in the parietal lobe, so there will be dark spot when the patient look on to the ground or